Unfortunately, since you were with us last, suicide has been all too frequently in the headlines. We've had, Ciara Pugsley, Aaron and Shannon Gallagher, one of your cabinet colleagues, Shane McEntee. These are all just high-profile ones. We know that more than one person a day takes their life in Ireland. Over 500 is the latest figures for, is it 2011 or 2012? So what are the government doing, what are you doing in particular about suicide prevention in Ireland?
Well, Ray, I know now you think that I'm being condescending when I say this, but I don't mean to be, and nor do I mean to be patronising, because I think it's far too serious an issue to play politics with, or even to, deal with in any kind of flippant way. But I do think that the public discourse that's surrounding this is helpful. We have to be very careful, very balanced. You don't want either to make it be seen as a viable option. You really need to be very careful about it. And I do approximately, whether it's a station like this, which is national, or a local stations, about 3 interviews a week in relation to suicide.
So what are you saying to them in these interviews? Well,
what I'm saying to them is that we have done a substantial amount, and I think the fact that we can now talk about it and it's no longer the deep dark secret, I think will be of help. Last year when I was talking to you, I think the one question on everyone's lips is, why aren't we getting to the group of people that are most vulnerable? And that is young people, early teens, late teens. It's moved on from there, but that particular group of people. Since then, what we've done is we've issued 2 different sets of guidelines. One in relation to bullying, which can often transmit itself into poor mental health, and indeed a follow-on to self-harm and suicide. And the other one is the Mind Your Mental Health, which are the guidelines that we recently launched for secondary schools. I again say I would much rather that we started earlier and went down into primary schools, but that's a different piece of work, and we are working on it. The other thing we're doing is we have a new director in relation to the National Office for Suicide Prevention, and I don't think a new director is enough. Great guy, very highly qualified,
Jerry Raleigh,
knows exactly what he's doing, comes highly recommended. We really need to start to rebrand that office. I think what it was originally set up to do was probably gather information, make sure that groups out there had a point of contact. It needs to do more than that now. And we need to take a serious look at how that office starts to promote both itself and the policies that it is about to implement. And we need to do that. We need to go to where people are.
Okay, now 2005 Reach Out,
yes.
And it was a report. It's sort of the National Suicide Prevention Strategy, if you like, right? That's 8 years ago.
Yes.
Now, the year before Reach Out was published, there were 439 deaths by suicide in this country. Now it's over 500. So it's obviously failed miserably.
Well, I wouldn't say it's failed miserably. I think what it's done in terms of, again, and I suppose we'd be both agreed in relation to the amount of groups that there are around the country who are desperate to help their own communities. Usually out of personal circumstances or community tragedies, these rise. And I think, the National Office, which Reach Out, it was one of the central points of Reach Out, that you would have a National Office for Suicide Prevention. I think that it has done a lot in terms of the structure. In terms of the structure and what we set up. We are the most informed country in Europe in terms of information around suicide and self-harm. It has managed to roll out training. It has managed to get into communities. But we need to
see the problem, Kathleen, is all you say is factually correct.
Yes.
There is training and there are organisations in communities, but they're all over the place.
Yes.
This is the problem. The great thing is this is a hopeful message. There are so many people out there who want to help.
Yes.
There are so many people out there who want to lower the number of people who take their lives by suicide. Like a few weeks ago on the Late Late Show, that man from the Secret Millionaire, Jim Breen, he's on Cycle Against Suicide. He said there's 600 organisations in the country working in suicide prevention. I think that's over the top.
Yes.
But unless it's organised.
Well, let me tell you.
An organisation needs leadership and it also needs a strategy.
Well,
and from where I sit, neither leadership nor strategy exist in this country.
Well, what we're now, we have a strategy for 2013, and what we're thinking of doing within that strategy, and again now it's about rebranding the office, refocusing it, taking it in a different direction. Yes, there are organisations in virtually every small town in the country. And I said to you before that it's very difficult for someone to go out and say, well, actually now, we're going to have one big organisation and you're not needed anymore.
I don't think that's the answer. I don't think that's the answer.
And
that's
neither
not the
do
answer,
I.
no.
And neither do I.
No.
And what we're going to do is we're going to take a serious look at I hate to use the word tendering now in this context because it has all sorts of connotations about business plans and all the rest of it, but nevertheless we do have to take that into consideration. What we have to make sure of is that all of these little groups, these very well-intentioned groups, are giving the one message and are trained in how they deliver it, right? Now we're going to have to get an organisation that does that for us, and there are organisations out there that can deliver that. I mean, they trip off the tongue, Console, Pieta House, the Samaritans.
So what you're thinking about is employing or subcontracting out this job to one of the extant charity organisations. So it could be Aware, it could be Console, it could be Samaritans, it could be Pieta House.
Yes.
And they will run the suicide prevention strategy for the government.
And also in relation to the smaller groups that are out there, that there will be a point of contact for them, because clearly you can't have people at the end of a phone or maybe making house visits or community visits or whatever, that taking all this on board to
that
themselves,
aren't qualified to do so.
Well,
that's another.
Yes, that's part of it. But even if they are, we have to be very careful as well about how we deal with people like that they have in fact someone to come back to.
My sense is, and I've spoken to an awful lot of people on the phone, from national organisations to local organisations over the last months. My sense is that people would love a structure to feed into.
Yes. Well,
and they want some sort of uniformity. If you set up an organisation because your brother or your friend took their life through suicide, and unfortunately that's happened, it's a real tragedy, and people want to do something after that, well then there should be some system that you can go, well I can feed into this. It's like tributaries going into a big river, that all the energy is harnessed and goes into the main thing.
And that's the plan.
Yeah.
I mean, you can't, because even what worries me is that, let's assume that the message is correct, even in these small groups. Let's make that assumption. But even the people delivering the message, they need support.
And training.
Yeah. And they need to have a reference point that they can pick up the phone and that they can come back.
And they need to have standards which they have to achieve before they can set themselves up as an organisation. And the fact that, and this is sort of the organisation of suicide prevention, but until we get that right, we're not going to save lives. So it may sound to people that this is a bit heartless in this conversation, but people need to achieve certain standards. The fact that you can go out and set up an organisation and take a call from somebody who could be suicidal, and you don't need a licence for it. There is no, the government isn't. You go ahead, do what you like. I think
that I'd be fairly tuned in to where sort of. But I mean, if someone phoned me, and I'm not certain I'd be able to do it, and I would be horrified at the thoughts of having that responsibility. It would really worry me. And the other thing that we need to do as well is that all of these groups, if they don't reach that standard, and if they're not prepared to buy into that sort of training and that sort of structure, then maybe it's a case of they have to re-equip themselves in order to meet that.
But then you have to provide the training for them so they can re-equip themselves. I want to talk to you about GPs as well, and we'll talk about that and more. And we need. How about we are? Nothing new here then, says Anna. I read an article a few months ago. Irish coroners were interviewed. Very few would speak to the reporter of those that did. Some of them said they reported only 15% of suspected suicides as suicide. Therefore, there could be a couple of thousand suicides a year. Pump some more funds into it. Road deaths are down because the RSA have so much funding. One thing the government can do to stop suicide is to give debt relief to people struggling in these austere times, says Aoife. And let's down to brass tacks. How long do you have to wait for counselling? And what happened to the Vision of Change report? We'll talk to Kathleen Lynch about that. And will the bullying organisations link in with the suicide organisations who are now being rolled out to the schools to inform teenagers? Ask Keith. We'll answer all those questions after a quick commercial break.
The Ray D'Arcy Show with Aviva.
Because the car insurance quote should be all about what you want to hear.
Kathleen Lynch is with us, and she's the Minister responsible for mental health. So GPs, in all the reports right back 8-10 years ago, they say that for a lot of people the first point of contact when they have a mental health issue or they're feeling suicidal is their GP. And yet to this day, not all GPs are trained up.
Well, another bit of good news. We have just concluded an arrangement with the Irish College of GPs, general practitioners, and funded them to provide a course in relation to a first contact GP training in relation.
Will that be mandatory?
Yes, it will, because it is. If it's the colleges doing it, then it will be part and parcel of the education.
Okay.
The other piece that we're doing is that GPs will now have an option, and we've just recently rolled this out in relation to a counselling service. Now, counselling is not for everyone, you know. Not certain that everyone can take sort of what emerges from counselling, but in the event that your GP now feels that you need counselling, not necessarily the medication, not necessarily the acute unit, but counselling, you will be given a little notice to explain to you exactly what it is and a telephone number. And when you ring that telephone number, you will be put in touch with a counsellor in your area. And this has been done through a fund of about 7.5 million, where we are buying in counselling hours.
Great. Now, Professor Ella Arensman from the NSRF, which is National Suicide Research Foundation, she wrote an article recently, or wrote a report which was featured in the Irish Times, and she quoted a system that was used in Germany, and they cut down their number of suicides by 15%. Now, if we cut down our number of suicides by 15%, that would be 75 lives changed.
Yes.
And it's not. It doesn't seem to be rocket science. It just seems. What do you think is what's going to happen next? Do you think there's going to be a strategy? Think there's going to be a real approach, political will on suicide prevention?
Well, I think the will is there on all sides, Ray.
Well, it is generally from the public, but I don't think it is there from government.
I would tell you that there is probably a greater will in government in relation to mental health and suicide than in any other area.
Well, why aren't people hearing about that? People need hope.
Well, and they do, and it's the absence of hope that usually leads people to despair. Yeah. But we are doing a huge amount of work in schools, for instance. The type of research.
What are you doing in schools? What's happening in schools?
It's a whole of school approach. And when I was here last with you, I told you that we had someone working on how do you reach young people in school? Exactly how do you do it? And I know guidance counsellors now have been very upset by what we've said, when it was never meant to offend or even take them out of the picture. But basically, what we're doing in schools is that it's a whole of school approach. There are guidelines and training available to the schools.
When you say available, is it mandatory? You see, the problem with schools is that if certain schools have a certain atmosphere, a certain culture,
right, and the type of chaos that it leaves after it, I think no school will reject what we're proposing. The school and Board of Management needs to get together, because it's about the Board of Management as well. It's about the parents, it's about the teachers, it's about everyone that works in the school community, and everyone. When the school requests training, the entire school will get it. Safe Talk, Assist, so's that, and young people as well, by the way.
Tell people what Safe Talk and Assist are.
Safe Talk and Assist is basically a programme whereby, and in the first instance, it's for people that are working in certain areas that need to recognise the first signs of distress and how to deal with it.
Okay.
Safe Talk is how to talk about something in a safe and appropriate manner. Okay. So, you know,
the part of the problem is, I don't want to get in your case all the time, but like I in making phone calls, I rang this Breaking the Silence, and I spoke to a lovely woman, and they provide assist courses.
Yes.
And I was going, well, why do you do it? Oh, we do it because we want to give them out. But it's ad hoc. To do a good job, but it's only when they can find the space, when they have the money. Do you know what I mean? Well, it doesn't seem that there's an organised attempt to get assist into all the places it should be.
Well, and funny enough, there's a huge amount of people trained up in Safe Talk and Assist in this country.
How many?
I mean, there's in Safe Talk, I think it's about 3,000, and then you expect those to go on, and you know that ripple effect, and it does have a ripple effect. Not everyone needs to have the training.
Would you agree that it is a little bit all over the place? Because you're in your job 2 years now. And you've done a lot of reading, met a lot of people, made a lot of phone calls. Do you think it's all over the place and somebody needs to grab it by the neck?
I think the project in relation to how we distribute and organise the smaller groups, I think will reap dividends in relation to organisation and having a more coordinated approach. I would agree with you, yeah.
And do you think somebody as high up as Enda Kenny needs to come out and say, we have a plan, you know, we, this is what we're going to do, we're putting this amount of money into it. We know things haven't been the best over the last few years. We had a strategy, but it's sort of redundant. So we have a new strategy now.
Needs to move.
Yeah.
People are in a different space. The country is in a different space. Young people are in a different place as well, and we need to be where they are.
Right.
And not just young people, by the way. The figures in relation to people who take their lives by suicide, the age is moving up.
Yes.
Yeah.
It's mainly men. It's nearly 4.5 to 1 when it comes to men to women.
And there's a reason for that.
Yeah.
It's not that women don't attempt. They do. But men use more violent methods.
Will you stay with us over the news, because I didn't get to all our texts and emails here. We're going late to the news, and we'll talk to Kathleen Lynch more after that.
The Ray D'Arcy Show on Today FM.
Thank you very much, Juliet, and thanks to Paul Collins for sport. Now, Kathleen Lynch is here, Minister for State with responsibility for mental health. Now, we've loads of stuff here, Kathleen. Some of them I'll ask you for a response, some of them I'll just read them. I had my date set, letters written. I was going to take my life and couldn't see any other way out of the problems that led me to the way I was feeling. I'm in my 40s. Thanks to Pieta House, I'm still here and happier. There is help out there, and they need help from the government, because many people like me cannot afford to pay for counselling. Pieta House, how much did the government give Pieta House last year?
I have no idea. But
should you not know?
Well, of course, I should know everything, Ray, but off the top of my head.
But for example, Pieta House, right, is at the forefront of suicide prevention, and it also gets referrals from the HSE.
Yes.
You should know how much money they're getting from the government.
What we are doing in relation to Pieta House, it is about to come to Cork soon, and we have set up a whole structure in order for that to happen. Secondly,
the government have. Who's we?
The government.
Right. Okay.
The government has.
Right.
In coordination and cooperation with Joan Friedman. I mean, she came to Cork, saw the premises, thinks it's good, and also Sligo will be getting a service.
So if Cork, Sligo, Dublin, where else have Pieta House, then should every place should it be decided in a strategy that for every, say, 400,000 people, or every region, that there is a Pieta House or something, some such structure? Well, that's a strategy. That's forward thinking.
Yeah, but when I was talking earlier on, and I'm reluctant to say who we intend to partner with, right? This is the type of thing we're seriously looking at. The other thing is that, paying for counselling, as I was telling you about the counselling service with the 7.5 million, that will be for people with medical cards on very low income. So only. Well, there are other people available for people that can pay, clearly. But people that would go to Pieta House and their GPs decide they need counselling, then they can tap into that service.
Okay. What about the suicide crisis assessment nurse, which is mentioned in the service plan for 2013? It's a specialised nurse in the community to assist GPs with first contact suicide patients. Apparently 43 million is earmarked for 60 positions. Now, this is my understanding, correct me if I'm wrong, right, that there's this document called A Vision for Change, which was published in 2006, and it laid out the roadmap to achieve not a perfect, but a way better mental health system. Part of that is community mental health teams that will be in primary care units, so that in this building, this utopian building, you would have a GP, somebody would go and they'd say, I'm not feeling very well, and the doctor will be trained up because it'll be mandatory, and he'll say, I think you're probably suffering from depression. Have you had suicidal thoughts? He'd be able to have that conversation with him because he's qualified to do so, and they might establish that they have or they haven't, and he said, you need to go down to talk to my colleague Dr. Murphy, the psychiatrist. Dr. Murphy talks to them, and then they're in for counselling once a week or twice a week. That's how many of those utopian setups are there in the country? Do you know? Primary care with community mental health teams.
We have 120, but we intend
fully functional.
No, not fully functional. And
when you say 120, what does that mean? It's a building. Go on.
Because I think it is important.
Yes,
we're doing. It is the one door approach. The one door. You go in the one door, whether it's for the chiropodist or the counsellor or the psychologist. It is the one door. Last year, we got 35 million in order to put in place the types of posts we need in relation to the community mental health teams. But when I say 120, I need to clarify that. We intend to bring it down to 90, which will ensure that the teams that do exist will be better equipped. There's no point.
Would you be able to furnish me with each of those and what they have in each one of them?
Yes,
absolutely. So whether they have a psychiatrist, psychologist, psychiatric nurse,
and
community nurse.
Last year around, I suppose, August last year, when I was ill, the HSE discovered that they had a huge black hole in their finances, and everything stopped. Now, I was very upset about that. As a matter of fact, I was quite annoyed. I wasn't just upset; I was quite annoyed. And the notion that money that was ring fenced to produce community mental health teams would actually be not so much used somewhere else, but stopped. Some of it had been spent, but stopped. I was quite annoyed about what we have done this year, and in black and white, in writing, with guarantees from all the main players. Got both of them to write to me. This year, it is not just about the 35 million this year, but the 35 million last year. In other words, the 70 million for 2 years. Right. What that will do will give us the fully functioning, flushed out mental health teams, including the National Counselling Service. And this year, because it wasn't in the plan for last year, we're going to have to deal as well with people with intellectual disability. It's usually psychology rather than psychiatry, and old age psychiatry.
Okay. Can I let you know that the HSE staff who deliver Safe Talk and Assist are currently grounded by the HSE budget cut and are unable to travel to deliver courses. So currently in the west of Ireland, there is no training available. Does Enda know that? It's a disgrace. There's no point promoting such training on a Wednesday morning when there realistically is no availability.
The service plan for the HSE will in fact address that issue, because it was a major issue and it's something that needed to be addressed as quickly as possible. Okay. And the new service plan, this year's service plan, will be a far more realistic service plan, and a service plan which will be delivered, rather than the sort of, I don't know, last year's service plan, it was impossible to deliver it. Okay.
At long last, we have a government that are doing something and care. Don't be so hard on them all. They're doing stuff previous government hadn't the stomach for. So I felt a bit bad after last time we were in. I felt I was a bit hard on you, but that was just out of frustration. Kathleen, you understand that?
I do.
Yeah.
Okay.
I think you should give more praise for the new GP counselling service, Ray. That's the coalface service the community needed, and she accomplished it. You also accomplished a one number. So in June, tell us what's going to be launched in June.
I suppose if you say to anyone in Ireland that's never had contact with any kind of distress or mental health service or community-based service, if you said to them, what's the organisation that does this? Samaritans. You know, it pops off the tongue. Samaritans. Of course, they're not the only ones that do it, but they're the ones most known. Up to this point, the Samaritans had a low-cost number, which was funded by Aircom or Telecom or whatever transformation they go through, but they did it for a number of years and did it very well. What we've managed to pull together are, because we discovered that very few people now who are in distress make phone calls from landlines. They actually use mobile phones. And yet the low cost number didn't operate in relation to mobiles. So what we did was we pulled together, with the help of the Samaritans, we pulled together the 6 mobile providers, and we got them to agree that from next June there will be a no cost number, and it is an international number.
No cost.
No cost.
That'll get you to Samaritans.
Well, hold on a second now. And basically it will be a 112, 123 number. It's sort of, we're hoping that it becomes so familiar to like 999.
999, right. Great.
Like 999. The Samaritans then will signpost you. If you ring and you need a particular, type of service, say for instance, they feel that Console, Aware, any of the other organisations are best suited to you, they will transfer you to there.
Okay. But what you're saying coming down the line is a streamlining of all these charitable organisations, that some of them are going to be subsumed under others. Some of them who are providing services now may not be needed.
I'd like to think that there'll be closer cooperation.
Closer cooperation, right. My husband took his own life almost 3 years ago now. He suffered with depression and alcoholism. Which came first, I just don't know, but the two go very much hand in hand. Once he admitted that he had a problem, we set about trying to get help. He had several trips into treatment centres to tackle his drinking, which were successful for a time. After a while, he started to improve. After his first suicide attempt, we ended up in A&E, where the nursing staff said they couldn't watch him or prevent him from leaving, so I stayed all night on a chair guarding him. There were several more attempts after that. He eventually ended up in St. Pat's in Dublin, on and off about 6 months. My point is that we went for help, but he didn't get the help he needed. He was discharged in February 2010 and he died in March 2010. The services just aren't there to meet or help people like my husband. You see, if there was a community mental health team in his area, he would have been visited in his home on a regular basis by a psychiatrist or a psychiatric nurse, and maybe.
Well, the other thing we're doing as well,
this woman wouldn't be emailing today.
I mean, I've heard some, not just. I wouldn't say they're horrendous stories, but terribly, terribly sad stories. And basically what we're going to do in relation to A&Es, our emergency departments, is we're going to have 2 nurses in there that will do the assessment. First of all, the people who are in accident and emergencies have to stabilise and do the usuals as someone comes in, if it's a cut, if it's a whatever, if people's stomachs need to be pumped, that type of medical stabilisation. And then these nurses come along and they determine their mental health status at that stage and do a follow-up, transfer them to a more appropriate service. You know, maybe it's just a phone call, but you know, that type of story, it's not the first I've heard of it.
No, not being negative, but the increase in suicide is directly linked to the dire poverty people now find themselves in due to this government policy. Counselling won't cure this. Like as far back as 2005, I was reading Reach Out again last night, and there's a full page on it. I printed it off there. Direct link between unemployment and mental illness, depression and suicide. Now, we knew that before the current recession, and yet nobody has come out with a public service announcement going, mind yourselves, mind your mental health when you're unemployed. These are the things we suggest you might do. That hasn't existed. Well, and that's preventative medicine.
Well, I think that actually has.
In what? I must have missed it.
Well, I think we probably, it's where the message is being delivered.
Yes.
And this again, I'm coming back to rebranding.
Where has that message been delivered?
Well, the difficulty is it's not being delivered where it should be delivered. Yeah. I mean, I keep making the point that I don't think young men who are feeling suicidal are watching the 9 o'clock news and waiting for the ad to come on afterwards. Right. You know, it's where we place the message. And I think it was either Monday or Tuesday, the National Office got sign off in relation to a new advertising campaign. And it's going to be a very direct, it's going to be a message that hits the right notes. I mean, for instance,
and particularly men, because despite the high profile suicides of late, it is still young men who are taking their own lives. And the
message, Ray, that you give to, for instance, a 15-year-old is not the same message that you give to a 35-year-old.
No, yes.
And we have to recognise that, and that's what we have to do.
But there has to be a strategy around that.
But there is a strategy.
But there can't be money going to various organisations all sending out a different message. You know, that has to change, Kathleen.
And it is changing.
Yeah.
It is changing. Yeah.
Yeah. It's good to hear Kathleen Lynch championing services for mental health. However, Ireland's suicide statistics stand out over other European figures because of the higher percentage of young men featured. I have extensive experience of services with children and find that many schools are in denial about bullying, and that is all too easy for young people, particularly young men, to be written off by our society at an early age. Something Kathleen could attend to is the perpetual nonsense of psychological and psychiatric services not accepting referrals of young people aged 16 to 18 because they're not adults.
Well, that's something we have already.
Also, it'd be worth asking a psychiatrist whether the profession sees suicide ideation or acts as evidence of mental illness. My personal experience is that it is quickly assessed and described as a conduct or personality issue and little else happens. For the family it is a mind-blowing crisis, but for the profession it is a matter of placing names on waiting lists and offering appointments months after the point of crisis. And to say to somebody who's in a moment of crisis, well, there's a waiting list for 6 months for counselling, that's...
No. Again, this new counselling service...
Do you ever feel sort of that...
under pressure?
Yes.
Well...
Snowed under. Do you ever feel that...
Relentless is the word I use.
But it's doable, Kathleen. It is doable. And there's so many people who want to help.
It's very
there's so much energy out there.
And I keep talking to people about harnessing the goodwill that's out there. And I just keep talking.
But they need leadership and strategies.
They do. They need leadership and they need strategies. Could I just say about the 16 to 18 year olds? I always class myself as being sort of very average when it comes to if it were my child. That's the position I always put myself in, if it were my child. And when I discovered that teams that were getting huge resources in the country actually decided that childhood stopped at 16, I couldn't believe it. I actually couldn't believe it. So we know...
And adulthood, what happens there for 16 to 18? They're in no man's land, aren't they?
There's the gap. I mean, there's the gap, and the gap is usually ridiculous. What you fall through. So we now have a strategy and a time frame. It will be up to 17-year-olds this year and go on to 18-year-olds next year, and it will be a continuous service.
Do you think that an audit should be done of all the organisations working in the area of suicide prevention in this country? Do you think Because you don't know, for example, I asked you how much money the government gave to Pieta House. You're the Minister of Responsibility. You should know that off the top of your head. I'm sorry, you should. You know,
maybe.
Yeah, I would think. I would think you should.
Okay.
Okay. I can tell you that in 2011 it was 100,000.
Well,
they got from the National Office of Suicide Prevention.
Well, it will be far more this year.
Now, Will has marked these NB. I'm a Garda Junior Liaison Officer and I'm trying to get a teenager counselling for what I believe to be depression. I recommended going to a GP. The young person was then told that they could be on a waiting list for 18 months. My heart sank as I gasped in total disbelief. I won't give up, but it should not be so difficult to get help for a teenager, especially if they have asked for help. The talking has to stop at some point to be replaced by action. And I work as a psychotherapist in a school, and every year for the last 3 years this government has cut funding. This government really are doing a lot not. And the guidance counsellor has become a point of contact for teenagers in distress, and the funding for guidance counsellors has been cut in schools as well. So, does this not be, for example, education needs to be in on this, don't they, as well?
Well, that's...
And finance, and it needs to be a cross-departmental thing.
Well, I've been singing this song since I got the job.
Can you do something about it?
We did.
Yeah, you did, okay.
I mean, education, the Child and Adolescent Agency and ourselves have come together in relation to the guidelines for mental health in secondary schools. It's a cross-departmental piece, which is very, very important.
Right. Well, look, you're achieving something, and I hope that I think people need just hope. I say that, but they also need direction, and for that they need leadership, and the leadership needs to put in some sort of shape so that people can row in behind it.
Yes,
there seems to be, and it's worrying sometimes, the number of people who are on television, on radio, and in papers talking about this, and it's just all over the place. Well, and people are throwing out statistics here, there and everywhere, and it's time for someone like you to grab hold and make sure the right message is.
If you're in crisis and if it's your child, are very poor comfort.
Yeah, yes.
Very poor comfort. The office is going to be rebranded. The strategy, I believe, needs to change because we're in a different space, and the things that distress people are different. I think unemployment and worrying about the roof over your head is a major problem. I mean, I can only imagine what it must be like, the prospect of actually losing your home. I can only imagine what that must be like and the stress that causes. So, it is a different space. We need to be there with people, and that now sounds pandering to and patronising. That's not what it's meant to be. We do need to be in that space. We do need to ensure that will happen. And, when we get that strategy and it's been drawn up, and the office knows, because I've told them that I wanted to go in a different direction and I wanted to rebrand, and I think there are a lot of people working on that, and that needs to happen. The other thing that needs to happen, and I'm saying it here now, maybe I shouldn't be saying it, but I am saying it, is that in terms of a vision for change, because this is not just a one piece, this is a puzzle that all the pieces need to fit. In terms of a vision for change and the community mental health teams, they need to be in place so that when someone is in distress, it may not always end by way of them taking their lives by suicide. You may be able to divert them out of that.
Do you feel responsible for putting them in place, or whose responsibility is it?
I feel completely responsible.
So the buck stops with you?
I have never said otherwise. The buck stops with me. And what
about your relationship with James Riley? Is that important or unimportant here?
It's important insofar as I need him to support me.
Yeah, and then he needs to be supported by the Taoiseach.
Well, I think we have that support. I think from time to time what happens is, and I know that the Minister for Health is often criticised for maybe saying that we need to take control of the delivery of health back into the department. I think what has happened is that you have an organisation that delivers the service, which in my opinion does it in the main in a very good way, and yet but the decisions that are made in terms of where the money has been spent is been made by that organisation, and it seems to have at times, and it happens during the summer, at times it appears to me that it takes very little notice of what the Oireachtas decides.